So you might be wondering which side of your hip to use the ball or the hip hook on, and the answer is both. When you have tension in one side, oftentimes that will manifest in symptoms on that particular side of your body. However, what will happen over time is as you use the hip hook and as you release tension on one side, tension is probably on the other side as well, and that will start to get your attention. So when you're starting off with the hip hook or the ball, the goal is to actually work on both sides at the same time. So what will happen though is that when you work on the side that's tighter, you will experience more tension and more pain on that side. So I would recommend that you work longer on the side that feels tighter or that is worse. Now, another thing that you may want to explore, and I talk about this in my book as well, is which side of your hip is tight in a way that is creating a pelvic rotation, because it's when the pelvis gets rotated forward that changes the mechanics of the leg as it works its way down the body. Also can affect the SI joint and the low back and some of the symptoms that you're experiencing. So it's a little bit difficult to figure out which side of your pelvis is rotated. The easiest way is to go to a physical therapist or a chiropractor and have them tell you. Then you know which side maybe needs more attention with the hip hook and also which side would benefit from the realignment exercise. But if you have someone with a keen eye at home that can help you, it is possible to figure it out on your own. And I'm going to teach you that now. So when you are sitting with your legs straight forward, if you were to look straight down at your feet, like someone was standing over you looking straight down, you can look at your ankle bones to see if one ankle bone is forward or backward relative to the other one. And you have to look at it from a vantage point of straight down so that you can see which one would be forward or which one would be backward. So this is called long sitting. When you're in long sitting, if one is shorter, meaning one of your ankle bones is closer to your body, then that leg is likely to have an anterior rotation. If you think about if it was my right side here, if I was rotating forward, it would actually make my leg go shorter in long sitting. But it's different when you're lying down. And this is how you can really test to see if it actually is an anterior rotation, because there can be lots of other kinds of rotations in multiple planes or hip hikes where one is just going up or down. So there's some complexity to that. But it can actually be simple if you identify that when you're in long sitting, that one leg is shorter. And then when you go to lie down, all the way down, that same leg gets longer. So in this position, if it was my right side shorter, and then it gets longer when you lie down, then it would be a right anterior rotation. So you can see how this is a little bit difficult to do on your own. You really need someone at your feet, looking straight down at your feet to determine what is happening and what is changing as you do that particular test. But if you do identify that one leg goes from being long when you're laying down to short when you're sitting up, that's a sign of an anterior rotation. And that's the side you should focus the hip hook on a little bit more, and also the side that you should really focus the realignment exercise on.